Hi everybody, this is Dr. Mark McCauley with the EKG Minute. So today we're going to go over the differences between atrial fibrillation and atrial flutter on an EKG. So first of all, with atrial fibrillation, you have a rapid and chaotic rhythm that often affects the regularity of the QRS complexes. And this rapid and irregular rhythm actually occurs primarily in the left atrium as it spills on down into the ventricles, causing the ventricles to beat irregularly. Patients with AFib typically have chest pain, palpitations, and dyspnea. And what you can see on the EKG is, first of all, a loss of a P wave, a loss of atrial regularity, and then you see a fine baseline of irregular atrial activity. And then you usually see what's called irregularly irregular QRSs. And what this means is that you have differentially spaced QRS waves, and based on the last two QRSs, you're not going to know how far the next QRS is. And so this unpredictability of irregular waves is why it's called irregularly irregular. In example 1 here, you can see an example of coarse atrial fibrillation in which the baseline is very choppy, and that signals that usually this is pretty new atrial fibrillation where the voltages in the atria are still pretty good. And then in example 2, you can see fine atrial fibrillation, where the atria have had atrial fibrillation for a long time, so the voltages are very low, and you can hardly see any deflection from baseline. Okay, so now let's talk about atrial flutter. Atrial flutter is related to AFib, but it's a little different in that it comes from a circular rhythm going around usually the tricuspid valve in the right atrium. And what you see on an EKG with atrial flutter is sawtooth waves with a sawtooth shape, usually pointing down in the inferior leads, which is leads 2, 3, and foot, and then a terminal positivity of the sawtooth wave in lead V1. And you can have variable conduction to the ventricle. So in example 1, you see an example of atrial flutter with 4-to-1 conduction, and every fourth flutter wave you see a QRS. In example 2, you see an example of variable conduction where the flutter is going around, and based on how it hits the AV node can differentially transmit to the ventricle and cause differentially spaced QRSs. So that's the difference between atrial fibrillation and atrial flutter on the EKG. I hope this helps. Thanks and have a great week.